Nursing homes have been some of the facilities hardest hit by coronavirus. In one center in South Shore, more than 100 residents, or about 70% of the patients there, have tested positive for COVID-19.
The governor has promised better testing and more help for nursing homes. Katie Smith-Sloan, president and CEO of Leading Age and executive director of the Global Aging Network, joins us now. And Katie, let's start with what's being done on the national level, or what you're trying to do anyway on the national level to protect the elderly.
Well, at the national level, we're advocating for funds to make sure that all nursing homes in the country have access to adequate testing for their residents as well as their staff. You know, we need testing for patients who are admitted from the hospitals to nursing homes. We need testing for staff who, when they finish a shift, go home and then come back again the next day. And we need testing for residents, because without adequate testing, we can't target our precious resources to try to stem the tide of this really dangerous virus.
Katie, why have we failed our nursing homes?
You know, I think as a country, we have not invested in or fully appreciated the value of services for older adults. And this virus really just makes that very evident, that we have underinvested and underappreciated and undervalued them. We're second in priority behind hospitals for testing, according to the CDC, which makes it really hard to get access to testing. We're not a priority for PPE, as we should be. You know, when this virus was first reported, it was very clear that older adults and those with underlying health conditions were at risk. And we had an opportunity then to really target resources to nursing homes, which is where these individuals, older adults and people with underlying health conditions, live. And we didn't. And we're paying the price now.
Well, yeah, it was the first case, really the first big case or outbreak was the one in Washington State at the nursing home. I'm wondering, I realize it's a vulnerable population, Katie, but do we know more about why or how this virus is spreading so easily in these facilities?
Well, I think it's several reasons. One is these facilities, people are living in a congregate space, right? So they're living close together. Some nursing homes have 2 to a room, others just have 1 to a room. You're dealing with a frail population to begin with. But you're also dealing with the kind of environment where staff are coming and going. You have 3 shifts a day. People are going home at night, spending the night in their homes. Who knows what they're bringing in?
Without the PPE they need either, you say.
And they don't have PPE. So they come in, you know, our homes are unfortunately left to scrounge and scrape and sort of innovate to get staff the kind of protection that they need, you know. So they're using things like plastic aprons and plastic ponchos instead of gowns. And that's just it's not fair and it's inadequate.
So how do we change it and keep it from happening again?
That is just such a great question. And I think the way we change it is we start testing and we start making sure that homes have access to all the PPE they need. Right now with this virus, they're using more than 20 times their normal usage. That's a lot of PPE, and they need to have that in stock and readily available. Then I think with testing, we'll be able to isolate residents who have tested positive from those that don't. We'll be able to create isolation units, which are very, very important. We'll be able to send staff home who have, one of the big challenges with this virus is that many of the cases are asymptomatic. So just taking somebody's temperature when they come into work in the morning isn't enough, because that doesn't necessarily test whether or not they have the virus.
Katie, we just have a couple of seconds left. The big question a lot of people are asking now is, should they pull their loved ones out of these facilities, having heard what you just said as well?
If facilities can get the access to the PPE they need, they can protect their residents and staff. And that's what we need to make sure that they have.
All right. Thank you very much. Katie Smith-Sloan, president and CEO of Leading Age and executive director of Global Aging Network. We appreciate it. Be safe. Be well.
Thank you.
Thank you. You too.